I am 19 and have permanently puffy lower eye bags. What is the cause or a good treatment for this problem? I am 19 and have permanently puffy lower eye bags. I always get enough sleep and drink lots of water, but they never go away completely. They show a lot more when I smile or look away. These puffy bags are shattering my self-confidence and I want them gone. I haven't been to any doctor about this yet, but I was hoping to get some tips on what it's called, what could possibly be the cause, or a recommended treatment without surgery or injections.
Thank you for your question. You're 19 years old and you describe in wonderful detail and with the photos you submitted that you have these permanent puffy under eye bags. You mentioned in your question that you haven't seen any doctors as of yet and that you want to get some tips. Well, I'll certainly help you understand what your situation is based on the photos you've submitted. I'm a cosmetic oculofacial plastic surgeon. I specialize in eyelid surgery. This means that my background training was first in eye surgery and then super specialization in plastic surgery of the eyes and face. Complex as well as straightforward cosmetic surgeries is something I do a lot, and I've been doing this for over 20 years in Manhattan and Long Island. So I can certainly speak to you from my experience dealing with this situation. It's time to learn a little bit of anatomy based on your photos. What you're seeing when you describe this puffy bags is lower eyelid fat prolapse. Now what this means is that the fat pads that are normally around the eyes actually push forward and become herniated and create these bulges. Now you may wonder why at the age of 19 do you have these bags when you may assume that these bags are typically the results of aging. Well, the reality is, in my experience, that the majority of people who have puffy under eye bags tend to have a family history where the under eye bags appear at all ages. In fact, under eye bags is probably the most common thing we perform in terms of eyelid surgery in our practice. It transcends age, ethnicity, and gender, and it just really is remarkable how people can be as young as 14 with significant under eye bags and as well into the 80s and above. So when you think about your situation, you may want to kind of look into your family history. I can tell you I've operated in my practice on 3 generations in the same family for this exact issue. So what you're ultimately going to need is some definitive procedure. The timing of that procedure is based a lot on when it's right for you in terms of your comfort level. Typically for someone like yourself, at 19 you don't have extra skin or excess sun damage or things like that because you're young and the photos clearly don't show anything significant from the external aspects of your skin. But the puffy bags I would approach typically under in a method called transconjunctival blepharoplasty. Now that's a long term, but it basically means we're working from the inside of the eyelid to address those fat pockets. And by sculpting those fat pockets, we're able to make the eyes look as if you never had those fat pockets pushing forward. It can be a very dramatic improvement in the appearance of the eyes, and I always say that the eyes really brighten up and the face brightens up as well. Many people who come to us for under eye bags frequently complain that they're tired of looking tired. So in a situation like yours, that would be most likely the approach that I would use. I think that any other approach, given the degree of puffiness that it appears to be with those photos you submitted, is not likely to be successful. A lot of times people try to hide or camouflage the puffy bags by adding filler, and unfortunately a lot of times the filler makes the eyes look puffier. And we spend a lot of time in our practice helping those patients who come to us from everywhere to just dissolve that filler. There's a very popular filler called hyaluronic acid that goes under various brand names like Juvederm, Belotero, Restylane. and we use an enzyme called hyaluronidase to melt that hyaluronic acid away. So I would discourage that based on the photos you submitted. I think it's important that you meet with qualified, experienced cosmetic surgeons and learn what your options are. At 19, you may be able to do this procedure under local anesthesia with light sedation. We have done this procedure for patients as young as 14 who are being teased at school for being on drugs because puffy bags under the eyes make people look like they're tired or they're not sleeping enough, and it's just a natural, unconscious communication. So meeting with doctors, learning about their approach, seeing the style by looking at before and after pictures, learning about how frequently the doctor does these procedures. I'm a strong believer in specialization and focus in certain areas. That's reflected in my own style and practice, and has certainly been very successful for me. I think that you want to maximize the chances for a good result and a result that you'll be satisfied with by using these parameters to help guide you. So I again meet with qualified, experienced cosmetic surgeons and then move forward. I think, in spite of your young age, that the puffiness must have a significant impact on your appearance. So I hope that was helpful. I wish you the best of luck. Thank you for your question.